is recognized for 60 minutes as the designee of the Majority Leader.
Let me thank the Speaker for yielding, and it is my pleasure to co-anchor this Congressional Black Caucus Special Order and to be joined by my co-anchor, the distinguished gentleman from New York, Congressman Torres. Thank him so very much for his presence here today. And let me acknowledge the chair of the Congressional Black Caucus as well, and thank her for helping to organize this special order, and as well to be able to discuss health equity and the black family and the reasons why the CBC strongly urges and supports substantial investments for health care in the budget for FY 2023. But I also want to especially acknowledge my friend and colleague, the Honorable Donald Payne, whose office initiative has always focused us on the enormity of health disparities in the African American community. But as I do so, let me start with a few comments to be made regarding the work of the Congressional Black Caucus. Let me acknowledge and express my appreciation to the President of the United States for hosting the members of the Congressional Black Caucus this afternoon that serve on the Executive Committee, and the concern and interest that the President has expressed in a number of issues that I think are important to where we are today in America. So let me borrow this picture from Congresswoman Kaptur, who heads the Ukraine caucus, and just remind everyone, because the Congressional Black Caucus has been at the forefront of fleeing persons persecuted. We have been a leader, whether it's Haiti or whether it's places in Africa or the Caribbean or Europe. African Americans have been at the forefront. And this happens to be the massive people that are trying to escape Ukraine because of the bloody and immoral and purposeless and vicious and vile actions of Vladimir Putin. And so we stand here today as well, recognizing the humanitarian crisis and recognizing as well that we as Americans are going to be supporting any people who are fighting for democracy. And as we fight for those people, we will also recognize that we will ensure that we are protecting democracy and the freedom of all people. With that in mind, we had a number of issues that we discussed, and I think it is important that health care was certainly a part of it, and the disparities dealing with African American boys and African American men, and recognize that we need to focus on eliminating those stark disparities that would result in less of a future for these young boys, for their lives turning around even before they enter school, that there is not an intervention to ensure that they become the best of what they can be. That is a crucial element of what we talked about as well. I'm very grateful that we were also in discussions on H.R. 40, the Commission to Study and Develop Reparation Proposals, and of course, the very positive discussion that we had. Breaking news is that progress will be made on the idea of healing and repairing and reparations, and we're certainly grateful for that discussion. I would also like to mention as I begin is that in the immediacy of the news of the day, we're well aware of my constituent that is now being held in Russia. That is Brittany Griner, an Olympian, a double honors WNBA player, and unfortunately, we don't have the proof of the allegations. We are disturbed, but we know that she has the possibility of being held for 10 years because of the alleged charges that they are making against her. And grateful to have had the opportunity to bring this to the attention of the President of the United States, and we expect that hopefully this situation will be looked at as closely as possible, and that help will be coming. I mention this because our chairwoman has always said, our power, our message, and tonight we speak of a multitude of messages that we'll have tonight focused on particular the issue of health care. And so, as a member of the United States Congress and the Congressional Black Caucus, we can't stop or start this without talking about COVID-19 pandemic that has laid bare for the nation to see the stark racial and ethnic inequalities exacerbated by the virus. In my home state of Texas, as of the end of September 2020, there have been more than 760,000 cases of COVID-19 and 16,000 deaths. According to the Texas State Department of State Health Care Services, 70% of the confirmed fatalities are people of color. In Texas, COVID-19 mortality rates are 30% higher for African Americans and 80% higher for Hispanics. One factor is that Hispanic and African American populations being more likely to contract COVID-19 is employment in occupations associated with public contact that cannot be done remotely. And we saw that in the early stages of COVID-19 when testing was not at its peak, that the numbers were so high in New York, New Orleans, Detroit, and yes, in Houston, Texas, because African Americans in particular were in jobs that they could not, that they had hands-on, that they were encountering people, but whether or not they were metro bus drivers, whether or not they were TSA workers in the federal system, whether or not they were retailers in the grocery store, they were whether they were firefighters and first responders, police officers, we were finding out that they were being confronted by these particular issues. The idea of health disparities in the African American community lends itself to the very reason why this special order is crucial. Health coverage as it relates to African Americans in 2017, 10.6% of African Americans were uninsured compared with 5.9% of non-Hispanic whites. 89.4% of African Americans had health care coverage in 2017 compared with 93% of white Americans. 44.1% of African Americans had government health insurance coverage in 2017, and 12.1% of African Americans under the age of 65 reported having no health insurance coverage. Chronic health conditions are prevalent in our community. 13.8% of African Americans reported having fair or poor health. We are prone to diabetes, cancer, particularly breast cancer, prostate cancer, lung cancer, brain cancer, and leading causes of death among African Americans are heart disease, cancer, and accidents. There are 11 infant deaths per 1,000 births among Black Americans. This is almost twice the national average of 5.8. And of course, we have a serious problem with Black maternal mortality, which I'm very glad that the Congressional Black Caucus has taken on as an important issue. I know that there's also the different kinds of cancer that impact African American males, and I know my colleagues will spend their time discussing that. So I think the point that is most important is that we realize that all of the indicia indicating disparities in health care unfortunately fall on African Americans. One I forgot to mention is obesity. African American women have the highest rates of obesity or being overweight compared to other groups in the United States. About 4 out of 5 African American women are overweight or obese. And so, as we discussed tonight, there are several things that I think we should be reminded of. 12 states refused to take the expanded Medicaid when the Affordable Care Act was finalized and signed by the President of the United States. I was here, we were fighting. In fact, we had included expanded Medicaid as a response to the public option that we were fighting for. I was a supporter of the public option, but we compromised. And lo and behold, if I may use that terminology, didn't it get taken out? Didn't we have states refusing to accept expanded Medicaid, and they're in the worst dire straits, which includes the state that is a poster child for uninsured, and that is the state of Texas. But in this Build Back Better Act, we created, with the work of the Congressional Black Caucus, a federal Medicaid process that we could opt in to, so that whatever state you lived in, the 12 horrific states that did not accept it, who suffer every single day, not the states, not the state government, but the people suffer every day, the children suffer every day, that we provided this in Build Back Better. I was so excited because we were pushing and working and sending letters saying you had to fix this issue of not having the expanded Medicaid. We were able to secure that, and here we are with Build Back Better, stalled in the United States Senate after we worked so hard to get a bill that has so many elements to it that deals with the disparities in health care. So as I conclude, let me indicate that the idea of these disparities fall right into the umbrella of H.R. 40, the Commission to Study Slavery and Develop Reparation Proposals. But the idea is to track slavery and its trajectory to 2021, why these stark disparities in healthcare and education and science and housing and the criminal justice system, but healthcare is life or death. And we can see it in a glaring panoramic of any community you go into, of hospitals that you go into, of hospice that you're in, that you see this disproportionate proportion of African Americans who either did not have access to health care in the early stages of their disease or either suffered from diseases that were in fact inherited from families down through the generations because of diet, because of living conditions or lack thereof. And we stand here today on the floor of the House to say that it's imperative that we work together as Americans to find a way to provide an even playing field for all of our children. And if it takes legislation that focuses specifically on diseases that we have that falls on our shoulders, as I am a breast cancer survivor and it introduced over the years triple-negative breast cancer legislation that I hope that I will see in the next few months passing for triple-negative breast cancer is more deadly in our African-American populations and Hispanic populations. So I know, or the cancer clusters that are in Fifth Ward, Texas, in my district, or Kashmir Gardens, because living in conditions where there are toxic chemicals that these people are breathing, or either they are eating them because they are in the soil that they plant their gardens in. Can you imagine, Madam Speaker? This is what we are confronting. And so that is why the Black Caucus rises on the floor today to be able to address these serious questions of health disparities, of which I believe is at this time a crucial moment in history for us to speak about. And so I'm going to express my appreciation. I will probably come back, but I would at this time like to yield the managing of the time to Ms. Chantel Brown, who I'm going to yield the managing of the time.
The gentlewoman from Texas can yield back, and the chair will recognize the gentlewoman from Ohio.
Will you recognize her as the managing of the time?
Correct.
Thank you. And so, though I may come back to speak later, I'm going to yield the managing of the time to the distinguished gentlelady from Cleveland, Ohio, Congresswoman Brown, and then we will have Mr. Torres and Mr. Payne, who will be a speaker. Thank you so very much. I yield back, Madam.
The woman from Texas yields back.